A new report from a state oversight agency finds state nurses and psychiatric technicians worked nearly 4 million hours of overtime just last year. That number is 4 times the national average.
These findings were released today in a 24-page report by the Little Hoover Commission. So we wanted to know, how much has that overtime cost taxpayers? And CBS 13's Adrienne Moore joins us now, and she's breaking down the numbers for us tonight.
And they really are some eye-popping numbers, you guys. Last year, the commission found overtime for nursing staff at state facilities cost $179 million. It's an amount taxpayer advocates call irresponsible, and tonight, they want the public to put pressure on lawmakers and say enough is enough.
What we found was rather shocking.
Shocking because a state oversight group found that those working with some of the state's most challenging patients clocked more than 3.5 million hours of overtime last year.
It just seemed like something was wrong with the way that they were staffing.
Of California's more than 14,000 nurses, the report found 85% of the entire state staff worked overtime to the tune of $179 million. That's equivalent to 1,800 employees working 40-hour weeks for a full year.
This is an extraordinary waste by the state of California.
John Capal is the president of the Howard Jarvis Taxpayers Association. He says this report by the Little Hoover Commission highlights the need for a major overhaul of 4 state agencies, including the California Correctional Health Care Services, Department of State Hospitals, Department of Developmental Services, and the California Department of Veteran Affairs.
There's a lot of accountability that needs to be had here, and it's got to start with our elected legislators who allow these collective bargaining agreements to allow this practice to continue.
The 24-page report found nurses were 3 times more likely to make an error when working 12 or more hours, which leads to an increased risk of on-the-job injury.
It's a vicious cycle. Nurses who work too many hours are often injured on the job, and then they're out, and then that creates a need for more overtime.
Now, with recommendations to the governor and legislature to cut overtime by 50% by 2018 and reform service and staffing policies, Capal remains cautiously optimistic.
That is realistic if this were the private sector. It could happen overnight if there was political will for it.
And 2 years ago, Assemblymember Sebastian Ridley Thomas authored legislation that would have banned mandatory overtime for nurses at state facilities, but it was vetoed by Governor Brown, who at the time said the issue would be best resolved through the collective bargaining process.
Mandatory overtime. You would not see that in the private sector.
Yeah, well,
no
and
way.
As we heard, the advocates all say, hey, this would be resolved just like that overnight if it were.
If it were the private sector.
We'll see what happens this time around with the governor.